All right, good morning, everyone. Welcome to the Perform Community Talk, Running for Beginners, Considerations for Injury Prevention. My name is Wendy Cunin. I will be acting as host for today's talk. I am the Research Operations Advisor at the Perform Center and a former gym goer who is now faced with finding alternatives to keeping active. As such, I recently decided to take up running, but then quickly noticed it's not so forgiving on the body. I'm therefore very happy to be hosting this talk, which will provide novice runners like myself with information to help prevent injuries. For those who are not familiar with the Perform Center, it is a preventative and health research center. In addition to the multidisciplinary research that takes place at Perform, it is also host to many community programs. We offer a variety of programs from people wanting to maintain a healthy lifestyle to those with disabilities or chronic illness who need assistance with training. As part of Concordia University, Perform also has various education programs, such as our clinical exercise physiology, athletic therapy, and dietetic internship programs, whereby students work with our certified professionals and gain real-life experience. Before the global pandemic, one of my responsibilities was to organize the Perform Colloquium, an academic talk whereby local and international researchers are invited to present their research. However, in these uncertain times, we decided to turn our talks to the community who we believe can benefit from it the most. Our speakers today are all certified athletic therapists and instructors at the Perform Center's Athletic Therapy Clinic. Leanne Papula has been an instructor at the Perform Center Athletic Therapy Clinic since its opening in July 2011 and is the team lead for the clinic. Their career began by working with a variety of semi-professional sports teams, as well as being one of the athletic therapy supervisors for Concordia Varsity. Victoria Robinson Mosaico has been at the Perform Center Athletic Therapy Clinic as a clinic instructor since 2013. She is certified in multiple specialties and was part of the sponsored medical staff at the 2015 Canada Winter Games. She has been the head athletic therapist at Champlain College since 2012 and is one of the owners at Clinique RTP Performance. Serge Savoie has been at the Perform Center Athletic Therapy Clinic as a clinic instructor since 2015. He also works as head athletic therapist and as a strength and conditioning specialist at Logic, where he has the opportunity to work with elite athletes as well as people from the general population. Before I pass over the controls to our lovely speakers, I would just like to request that our audience use the Q&A button to enter any questions you may have for our speakers. We will do our best to answer all questions following the talk. Please also note that this talk is being recorded and will be posted on the Perform website for later viewing. On that note, I will now pass over the mic to our speakers.
Thank you, Wendy, for the warm introduction, and thank you to everyone joining us here today. Vicky, Serge, and I are passionate athletic therapists who love helping our patients improve their quality of life and their performance through manual therapy and teaching proper movement. We are also instructors at the Perform Center Athletic Therapy Clinic, where we've had the great opportunity to see over 3,000 patients and have had over 200 student interns since its opening in August 2011. As some of you may know, over the course of the pandemic, running has increased in popularity since it's an easy and accessible activity that most people can do. As a result, we wanted to help do our part and diminish the risk of injury for individuals who have chosen to begin on this runner's journey. Before we begin, as Wendy mentioned, if you have any questions, please feel free to type them to us. This can be done in either English or French, and we will gladly answer in either language. So here's our running route for today. Over the course of this presentation, you will be given a brief overview of some of the key information we feel is necessary for new runners to enjoy their sport safely and effectively. To begin with, we wanted to highlight some of the numerous benefits that running can bring. Some experts in the field believe that the human body was designed to run, so it would make sense that it's associated with so many benefits. In terms of physical health, the rewards are abundant. In fact, as you can see here, multiple studies have shown that running helps keep our blood sugar levels under control, regulates blood pressure, and has a huge impact on metabolism. In fact, one study demonstrated that not only are calories burned while running, but that the human body will continue to burn them at rest for the following 14 hours as well. In terms of mental well-being, great benefits can also be seen. For example, running for 30 minutes, regardless of the speed, was shown to be enough to lift the mood of someone suffering from a major depressive disorder. Another study demonstrated that running had positive impacts on sleep and psychological functioning in healthy adolescents. Some of you may have heard of the term runner's high. This is because research has shown that running can help elevate our moods, similar to taking certain recreational drugs, since it stimulates the same pleasure and reward receptors in the brain that make us feel happier, help reduce our anxiety, and decrease our feelings of pain. Finally, here are some of the socioeconomic advantages of running. It allows us to get some fresh air and can be done alone or in the company of others while maintaining a safe distance, of course. In comparison to other forms of exercise, it is also relatively affordable in terms of what is needed at a beginner's level to start. I will now pass the baton on to Vicky, who will begin by going over the precautions we should all take into account before starting.
Thank you, Leanne. So the first thing you're going to want to do before running or starting any activity is to make sure that you are in good general health. If you're not currently physically active, and even if you are, it's a good idea to do a quick check-in to make sure that you don't have any contraindications when it comes to exercise and more specifically running. An effective questionnaire that many health professionals and gyms use to make sure that everyone is in good health is called the Physical Activity Readiness Questionnaire, and it's on the screen now. And more specifically, it's the PARQ. The questionnaire can be readily found online, but we're just going to go over a few key points with you. So you can see that we highlighted some of the main conditions and contraindications. We feel that this is a great guide to help you understand if you're actually ready for physical activity. So you might want to visit your doctor if you have a heart condition or high blood pressure, pain in your chest at rest, when you do physical activity, dizziness, loss of balance, or loss of consciousness in the last 12 months that was not due to exercise. If you have any chronic medical conditions or prescribed medications, or obviously if you have any musculoskeletal injuries that may still be causing you trouble. Having these signs and symptoms does not exclude you from doing physical activity, but it could worsen with physical activity. So it's always a good idea to check in with your family physician to make sure that exercise is safe for you. So just as it's important to screen your overall health, it's equally important to screen your movements before you run to ensure that you're efficient in your running pattern and to help give you an idea of where you might want to start your programming to reduce your risk of injury. Running is a single leg anti-rotational exercise. So that essentially means that we're jumping or hopping off of one foot and landing onto the other foot, in some cases absorbing up to 5 times our body weight when we land. It also means that while we are constantly trying to propel ourselves forward, we are also trying to slow down the rotation of our upper body and our torso. We really need to have proper balance, mobility, and strength to be able to withstand these forces. So here we have a list of some key tests that you can do before starting to run. This is by no means a complete list, but something we felt that was easy to replicate at home and representative of a lot of the components you would need for an injury-free run. I would like to note here that an inability to complete these tests does not mean that you should not be running, but it will give you a gauge of where to start. We need to keep in mind that running will inherently build our balance, our mobility, and our strength, which are the 3 kind of components that we've listed here. So barring the absence of any pain or major differences between the left and right side, an equal lack of any of these components just means that you might want to take it easy at the beginning of your run and then progress it with time. Again, it will just give you more time to build up your movement efficiency. So the first test that we have here is a single leg balance test, and obviously it's to test your balance. So as I mentioned, running is a single leg movement. So we really need to be able to stabilize our body on one pillar or one foot for a split second before pushing off and absorbing the weight onto the other foot. To do this test, you're just going to place your hands on your hips, lift one leg a few inches off the ground. You should be able to hold this for a minimum of 10 seconds and then repeat this on the opposite side. What we're looking for here is not just the amount of time that you can hold this position, because as I mentioned, we're only landing for a split second, but it's more of the quality of movement as well. There shouldn't be a great difference between one leg and the other. If there is a difference, this could translate to us loading one leg more when we're running, resulting in overuse injuries like bursitis, tendinopathy, and anterior knee pain. The next test here is a mobility test. We don't need a ton of mobility to run, but one of the most important mobility factors that we need is in our ankle dorsiflexion. So that's the ability to bring your toes up towards your body. We need about 15 degrees of dorsiflexion to run normally. This allows us to properly absorb force through our Achilles tendon when we land, and it allows us to clear the ground when we're in our stride or our flight phase, so we don't trip and fall. A lack of mobility in the ankle could result in us compensating by circumducting our hips a little bit to kind of clear the ground. Again, this can cause a whole bunch of problems like anterior knee pain, tendinopathies, or lateral hip or knee pain. So I'm demonstrating the knee to wall test here. Essentially what you want to do is keep your foot firmly planted on the ground and try to bring your knee as close to the wall as possible. The goal here is to measure the distance between your toes and the wall while getting as far away from the wall and still being able to touch your knee to it. Ideally, you want to have a distance of about 10 centimeters or 4 inches, but this will vary from person to person depending on their height and their leg lengths. Essentially, we shouldn't see a measure of 0. And we should also have the left side relatively equal to the right without any blocking, any pinching, or any pain at the ankle. If you do have any of these symptoms, you might just want to do this warm-up specifically before you start running. You might also want to see a healthcare professional and make sure that you don't have any other ankle pathologies that might hinder your performance during your run. And you could also look into some of the footwear that you're wearing to see if that makes a difference as well. The next group of tests here are our strength tests. So we talked about the fact that when we run, we can absorb up to 5 times our body weight when we land. So we really need to have the strength in our core and our lower extremities to withstand this force. The first test we have here is called the single leg hop test. So you're going to jump off of one leg and land on that same leg. And I put a plate down to where I landed, so it gave you an idea of the difference. You're going to then repeat this on the opposite side and again mark the distance. If we were doing this in the clinic, which we do often, we would usually measure the difference and the distance as well with measuring tape, so you can do that at home if you'd like. What's important here is not really the distance you can hop, but it's the difference between the distance on the right and the left side. You shouldn't see a difference of more than 15%. The second strength test that we suggest is the heel raise test. This tests the strength of your gastrocnemius, your soleus, and your plantar flexors, or more commonly known as the calves. These muscles are responsible for absorbing a ton of force when we land through the Achilles tendon, and it uses this energy that we absorb to then propel us forward like a spring. Considering we will be repeating this motion hundreds, if not thousands of times during a run, it's important to have the strength in our calves to prevent strains, cramping, or other overuse injuries. I'm demonstrating the exercise here on an elevated surface, but feel free to do this directly on the floor. We essentially just want to see you come up through a full range of motion in a straight line for a minimum of 5 times. The third test in the strength test series with wonderful music is the single leg sit to stand test. So this tests the strength and control in our leg as a whole and our ability to stabilize on that one leg. As you can tell, it's also testing my balance. So I'm demonstrating the test here, and we want to do this for a minimum of 5 times. Like the other tests, the quality is equally, if not more important here. You want to see a straight line between the knee, the hip, and the ankle at all times. You can see here that I'm a little bit shaky, so I might have a little bit of work to do on it, but overall, I would give myself a pass. I would suggest doing this in front of a mirror or even filming yourself. You might notice that you also start off very strong and then fatigue a little bit as you continue with your repetitions. This just might indicate that you need to start running at a lower volume and shorter distances, and then again, build up from there. The last strength test that we have is the dynamic trunk endurance test. This is a bit of a different test because we're specifically aiming to test the strength in our core and our lateral stabilizers of our hips, like our glutes and our QL. We really rely on these muscles to create a strong pillar so we can focus our energy more on projecting us forward versus letting our hips fall from side to side when we run, thus stressing joints and tissues in our hips and our knees, and not to mention wasting a whole lot of energy. Here we have two variations of the test. So the left side is the fairly basic version. This should be held for about 10 seconds, and you should be able to hold a straight line between your chest, your belly button, and your hips. We really don't want to see any sagging of the hips here. The option on the right is actually what a lot of elite runners will do, and usually you want to test this and hold it for 55 seconds. I can assure you I could not hold that for 55 seconds, but it's a good effort. It's a lot harder because we're relying solely on the lateral muscles to keep us up versus the left side, which we're using a lot of our adductors, which are on the inside of our thigh. So again, I'm going to mention that an inability to complete all the repetitions of these exercises doesn't mean that you're not ready to run. It simply means that you might want to start off at a lower pace. Like we discussed, running will inherently work on all three of those components, your strength, your balance, and your mobility. So you can always check in after a few weeks to see if you've improved on these tests. It also might be a good idea to refer to a specialist to make sure that you do not have any underlying issues that might increase your risk for an injury while running. If you were doing any of these tests and you do have pain or discomfort, it's important to consult with a professional to make sure that running will not aggravate any of these conditions. We would also encourage you to visit any of these professionals regardless, because they're really great at assessing sport-specific movement and a specific problem that you might have to return to kind of gauge a little bit your readiness for activity. So now I will now pass the baton on to Serge to talk more about running equipment and warm-up. Serge, you are on mute.
Thanks, Victoria. So unfortunately, there are running injuries. And that's one of the reasons why shoe companies trying to modify the conception of the shoe to trying to reduce the risk of these injuries. So we'll try to make some sense of all the changes that have been done in the shoe. So traditionally, we were more on that high to maximal side of a shoe. And we can see on that side that there's a lot more cushioning on the shoe. And the reason why they wanted more cushioning was to try to absorb the forces coming from the ground, these high ground reaction forces. So the foot would actually have more feel for the shoe and less so the force coming from the ground. And then a few years ago, actually, but we started to see the minimal shoe. Okay, so the first minimal shoe that really started were trying to mimic the barefoot running that our ancestors used to run barefoot. And their sense was that the foot was made to absorb the forces, and we should make a shoe that will let the foot do its job. So we can see that these minimal shoe have very minimal to even zero cushioning on the shoe. And it's actually really letting all the work be done by the foot. As you guys probably saw in different stores, there's a whole variety of shoes that come in between these maximal and minimal, and we'll try to look a little bit into that also. Another thing that we see a lot now is the heel to toe drop. So they're trying to modify that heel to toe drop to again trying to modify the biomechanics of the runner. Traditionally, we were more on that 12 millimeter drop. So it's really just the difference between if we take the thickness of the cushioning on the heel and the thickness at the front of the shoe. So on this shoe particularly, we have 16 millimeter from the heel, and we have 10 millimeter at the front of the shoe. So we can see that there's a 6 millimeter difference between the heel and the toe. And again, that was made to try to modify the biomechanics. Like I said, traditionally it was more towards the 12, but now we can see shoes that have 10, 8, 6, even 4, and up to the 0, where we see the very minimal shoe that have 0 millimeter drop. If we're looking at a more traditional shoe, we see here that we have one with a lot of cushioning. These shoe, usually when we heel strike, we tend to use more of this shoe because we need the cushioning to try and to absorb these forces coming from the ground. This shoe is usually heavier because we need all that cushioning, all the material to try to make the shoe support the foot a little bit more. And we see on the bottom, the runner striking with the heel. So we can see he has a stiff leg. So the forces coming from the ground, if we wouldn't have cushioning, would really go in all the way up to the tibia, the knee, the hip, and even to the lower back, and create some pain and some different injuries that could be created towards that. If we look on a graph on the left and we see where that red arrow is, we can actually see that there's a high and rapid increase in force coming from the ground that's transferred to the body. So, and that force coming from that ground is really a deceleration force. So every time we strike, we decelerate our body, we absorb all that force coming right through our lower limb, right to our lower back. And then after that, we start to propel ourselves forward with the force coming. If we're taking more of a minimal shoe and trying to see from there, we could see that the shoe has really zero cushioning. We could also see that there's a zero difference, 0 millimeter heel to toe drop. That shoe is usually lighter, actually pretty light, offers no support. You can see you could fold that shoe. It offers no support to the foot. So the goal is really to let the runner use his foot to be able to absorb that ground, or to feel that ground and to absorb the forces by himself. If we're using a forefoot strike, then it's fine. But if we're using a heel strike with this kind of shoe, then because there's no cushioning at all, we could see that a lot of forces go, and even more than with a maximal shoe. So that's the big difference with that. Remember that if you're using a maximal shoe, that shoe will also, the material will also deteriorate. So it has an expiration date. Okay, so usually depending on the shoe, depending on the materials they use, once you've ran up between 600 to 900 kilometers with a shoe, it's time to change that shoe, okay, because it's not doing the job it was made to do. So coming back to our runners, if we have, and there's no good or bad here, it's just two different types of biomechanics, but if we look at the runner on the right, we can see that he is using a heel strike, okay? So the foot is really in front of the body, so it's in front of the center of gravity, and it's creating it. We can relate it to that red curve on the graph on the left, and we can see that, again, there's that rapid increase in ground reaction force right at the start, and then we go and we can propel ourselves forward. If we're looking at the runner on the left with the green, we could see that when he's striking the ground, the foot is actually right under his center of gravity, okay? And then because of that, the runner will have a flex hip, a flex knee, and then we can translate that to the blue curve on a graph, and we can see that the force is really progressively going towards the runner, and it's being used to propel ourselves forward. So there's no deceleration phase on this type of running. So again, the reason that the shoe companies were trying to make shoes that were more minimal or a lower drop was to make sure that we start to strike with the forefoot and trying to reduce these forces. So I guess the big question is, does a type of shoe really prevent injuries? And the literature is really not clear on that. There's actually studies that show, or that say, that there's not one typical shoe or one ideal shoe that will fit for all runners, okay? Because different runners have different mechanics depending on how we were taught to run. Some people try to go back to forefoot running, and then when they get fatigued, they start to heel stride again. So there's lots of different strategies that are used with this. Also, what we used to see a lot with traditional running or heel strikers with the other shoes were lots of tibial injuries, shin splits. We used to see a lot of knee pain with the patellofemoral pain, ilio IT band friction syndrome, some hip pain, some lower back pain. And did the minimal shoe or the people adopting a forefoot strike, did it really change anything? Well, actually, there's some studies that show that the for example, a patellofemoral pain was reduced a lot using this type of shoe. But then we started to see injuries that we didn't see as much before. Like we started to see calf injuries, we started to see Achilles injuries, plantar fasciitis injuries, and we didn't see these as much with the other type of shoe. So again, it's not really clear that if a type of shoe will really help to prevent injuries or even all injuries. One thing that we could tell you is that if you're not injured, if you're comfortable in your shoe, then stick with what you have. Okay, there's no use changing just for changing. If you're looking for a new pair of shoe, or if you were having a bit of pain and you wanted to try something different, well, then when you go to the store, actually ask for different type of shoes. Don't let the shoe salesman just give you 2 or 3 pairs of maybe they're more like on the maximal side and let you choose into them. You can ask. I want to see some minimal shoe. I want to see something in between. I want to see maybe a 8mm drop or a 4mm drop. What's going to be the difference? And actually go and try them. Some shoe stores actually have treadmills where you can try your shoes. Others have a space where you can actually run a bit in them, because there's a difference between just walking with your shoe or actually running in them. So you want to try and make sure that it's something that you're going to feel comfortable running in these shoes. If you're running for a while in a 12mm drop, well, don't go right away to a 0. Okay, it's going to be too much. Maybe go to an 8 or a 6mm and then progress from there. Another thing that you need to look for when you're buying your shoes is to make sure you have room for your toes in your shoe. Traditionally, we used to have shoes that are very narrow at the toe box. And then again, we started to see different injuries that with the bunion. That's really created because there's not enough room for your toes. So the toes need to have room to wiggle in there and absorb the forces and trying to produce some forces. So if you have your foot in your shoe, a good rule of thumb is to really have half of a width of your thumb on each side as space, and that's usually a good toe box for the shoe that you're buying for yourself. Same thing for the length. At the end of your foot, if you could have at least half of a width of a thumb or even a full width of a thumb at the end of your big toe, to make sure that you have that room to breathe for your toes. Okay. Another thing that we could help you with to help with injuries is take smaller steps. If you're taking smaller steps, then there's good chances that you're actually going to strike closer to your center of gravity. So you're not going to strike with your heel as much or too much in front of your body. Because if you're striking in front of your body, again, we're creating that deceleration force and a lot of ground reaction force that's going up on your body. Increase the cadence. Okay, if you're trying to run faster, if you increase the number of steps you're taking per minute, you're going to run faster. Sometimes music can help with that. Okay, if you have a good tempo, you have a beat in your ear, it is going to help you keep a rhythm that's a bit faster. And the last thing would be to be light on the ground. There's actually a study that took a bunch of runners and they just asked them to go and run. And they were looking at the biomechanics of the runner. And they found out that 85% of the runners were actually heel strikers. Then they took these same runners on a different day, same footwear, nothing changed. And they just asked the runner, when you go out for your run, just try to be light on the ground. Make less noise every time you step on that ground. And they found out with just telling that now there was only 23% of the runners that were heel striking. So all the other runners were now either midfoot striking or forefoot striking. So that's a big change. So again, the study didn't show that the reduce of quietness were reducing injuries, but we could see that if we're creating less ground reaction force, then we're probably reducing the number of injuries. Another thing to look for when you're running is hydration. Okay, so especially these hot summer days that are coming, make sure that you don't go into that dehydration phase. There's actually a good site on the Runner's World that can help you find your own sweat rate, and then from the weight that you have, trying to see how much water you should drink at every mile. But on a good rule of thumb, try to hydrate at least 2 hours before you go out for a run, and then during your run, trying to maintain 5 to 10 ounces every 15 to 20 minutes that you run, and then rehydrate at the end. Same thing for nutrition. We have a great nutritionist at Perform that could help you with finding if you want to increase performance or lose weight or whatever your goal is. But a good rule of thumb, again, would be don't go out running on a full stomach, okay, because that's going to be difficult for you. But don't go out running on an empty stomach either. Okay, so trying to have something in your body, something to fuel, something easy to digest, and then you go out for your run. So from there, we're going to go into an activation routine. Again, there's lots of different exercises that can be done to activate. We chose a few that we feel are targeting the muscles that we actually use when we go out for a run. So we'll start right away with a standing glute activation. So again, this runner here looks like he's not doing much, but he's actually pushing with the leg that's closest to the wall. He's pushing on the wall. But the important thing to look for on this exercise is to make sure that the leg further from the wall is the one that's working. So we don't want that hip to go and move lateral. We don't want the knee to drive inwards. Okay, so that's what we're really trying to activate, the glutes from the opposite leg. The next exercise would be a cook hip lift. We like that exercise a lot because it targets lots of different things on the body. We're targeting the hip flexor on one side and then the hip extensors on the other side and trying to keep that all tight with your core. So we like that exercise a lot. Then there's the posterior chain exercise. So again, this looks like it's a stretch. It is kind of a dynamic stretch, but we want to make sure that we're keeping some tension on that elastic band or belt when we're pushing back down, because we're actually trying to create a plantar flexion with our foot to help with the calf, and then we're pushing with our hamstrings and glutes, so we're activating all that posterior chain that's going to help us while we run. And then we have some dead bug variations. Again, there's lots of different core exercises that could be done. We chose this one because again, we feel that it mimics the running pattern. So we just want to make sure that we're not curving that lower back. Okay, so we're keeping everything there neutral, and then we're pushing with a hip and opposite arm. If it starts to be a bit easy, we can even add a mini band to the feet and trying to create the hip flexors to contract isometrically while we push with the hip extensors. Then we go to a mobility routine. What's important with the mobility routine is really to try to keep it dynamic. Keep a good posture, and don't try to push it too much. Don't try to create range that you don't have. So once you're stabilizing muscles get stronger, you'll see that your range will increase and you'll get better at it. So the first one would be the greatest stretch in the world, which can look a bit complicated. But we're really just trying to push with that back leg to keep everything neutral from the lower part of our body. And from there, we're trying to create a rotation with our thoracic spine to trying to make sure that we don't create too much of that rotational forces that Vicky was talking about earlier. The next one would be a quad to performance stretch. So the quad stretch is a stretch that most of us already know, but it's just to go into that seated position right after to keep it dynamic and stretch that small muscle that's called the piriformis that's deep in your glute area, and trying to keep it loose so it helps you when we go out for a run. And then we have the inchworm, again, keeping the knees straight and really trying to push with our ankles, trying to get everything more dynamic in that posterior chain and keeping our core tight. Don't try to go too far if you can at first. Just make sure you go through, and you'll see that the range will increase once you get better at it. And lastly would be hamstring scoops. So it's just, again, to try to get that range from all that posterior side of the chain. And we can even finish it up with Frankenstein walk to try to make it more dynamic and get you ready to go in out for your run. So with saying that, I'm going to pass it back to Vicky to finish this run.
Thanks, Serge. So now that you've done your warm-up, it's time to get moving. Before discussing training programs, we wanted to touch upon certain things that can help you in your progression plan as well as reduce your injury risk. The key here is really to plan for your success. So the first thing that's really important is to plan your routes. This will help track your mileage and your time. And like Serge mentioned before, map fountains out if you need to get water during your run. This will also help motivate you because you'll be able to see your progression with time. And last but not least, it's important for safety reasons. Planning your route properly will ensure that you don't end up on terrain that you're not used to, like hills or trails, or that you don't end up in dangerous areas with high traffic volumes. The next thing you can plan is your music, and that's my personal favorite. And the music you choose, again, we kind of discussed it already, but it can help you define your pace and your cadence a little bit more as well as motivate you. So if you want to choose music that has a specific beats per minute to suit a cadence or a pace that you're looking to meet, oftentimes it can help you keep on track. The next aspect that is helpful to plan is your routine. This is important for a few reasons, but you want to try to plan your runs as much as possible and put them in a part of the day that works best for you. Some people like to run at the end of the day to relieve stress. Others like to start the day with it so that they're energized. What's most important here is that you're considering and putting thought into where you're placing your run. If you're having a very heavy week and a particularly long day where you feel like you might be physically tired by the end of it, you might not want to do a long endurance run that day, but instead plan a lighter run. Again, this will prevent fatigue and then consequently injuries. Likewise, you might want to plan a particularly taxing speed run maybe a day before or a few days after doing a heavy workout or another sport. This will also help you stay consistent. So there's a rule out there called the 21-90 rule, and it states that it takes 21 days to build a habit and about 90 days to change your lifestyle. So putting runs in a plan will help these lifestyle changes occur a lot easier. The last component to plan is your training program. So we're going to talk about this in a second, but it's probably one of the most important things to do. A lot of people think that running longer, harder, and faster will make you inherently better. And while this is true in some cases, it's really important to have a program that varies from endurance runs to speed runs, especially if you're trying to work towards a certain goal, a certain pace, a certain time, or a certain distance. These plans are designed to prevent overloading of the tissue, promote recovery, and train different energy systems, all of which will yield faster results and a diminished chance of injury. So here we have a few options when it comes to choosing a training program. Our goal here wasn't to give you a training program because there are tons of ways to go with this. One of the great tools that you can use are online resources. So we've listed a few here, but it's by no means an encompassing list. These are just some of our favorites. And what's great about these sites is you can usually find a number of programs, but you can also find a lot of running tips and resources for all levels of running. There's also a lot of applications on your phone that you can use, like Runkeeper, Track My Run, C25K, and Strava. These tools are really great because oftentimes they'll track your runs and kind of like a GPS, but you can also input your goals, your schedule, your running level, and it can generally just create a program that's kind of catered to you. Again, it's a small list of options. There are a lot out there. There's Nike Run. There's a whole bunch that you can look into and choose what works best for you. The last option is to visit a local running club. This is a great way to interact with other runners, integrate yourself into the community, keep you motivated, and obviously these coaches are really great to get a lot of resources from to help you in your run. Whatever program you use, I think the biggest tip to take away is that progression is key. You need to build up endurance, you need to build up tissue resiliency and strength, and that will take time. There's a number out there that says about 60 to 70% of running injuries come from training error. So this really is one of the key ways to help prevent injuries, particularly for beginners. If you're not used to training, it's always best to start with a light walk and progress to interval training from there. If you are already an exercise enthusiast, you can obviously start with some light jogging and then progress it as tolerated. You may be wondering, how will you know when you're ready to progress? So there are a few key ways we can track your workload and intensity, and we're going to go over them in the next few slides. So the first method is using the rating of perceived exertion scale, or more commonly known as the Borg scale. This is a subjective scale where you can rate your perceived efforts from a scale of 1, which is very light activity, to 10, which is maximal effort. Essentially, you're grading how hard you feel like you're working. This scale is linked to aerobic effort, and a few studies have shown that working on a level of 7 to 8 is where the majority of your aerobic training occurs. This would feel borderline uncomfortable, where you might have some shortness of breath and you can speak a sentence or two before having to stop. That being said, many beginners should start with a 4 to 6 on the scale until they become accustomed to the exercise. This would feel like you're breathing heavily. You can hold a short conversation. In this line of thought, you can see that if a run previously felt like a 7 or 8 and now it feels like a 2 or 3, you know that you're ready to progress. If a run feels like a 9, however, you will likely not be looking to increase your volume or your pace, and probably look at scaling back. Another great way to monitor your progress is through your heart rate. The American Heart Association advises that people aim to reach between 50% and 85% of their maximum heart rate during exercise. There are many formulas to calculate this, but we are going to present it in its simplest form. So the example here is that in the general formula is you take 220 beats per minute and subtract your age. So in the example we have here, if someone's 20 years old, their max heart rate should be 200 beats per minute. If they should be working within a heart rate of 50 to 85% of their max, that means that they should be working between 100 beats per minute and 170 beats per minute. If you're working at 190, then you might want to scale back because it's way beyond what your max heart rate should be. And then obviously on this line of thought, if you're working at the lower end at something like 110 and 120 and you feel like you can progress, you likely can because you have a large scale of where your max heart rate could be. Another way to progress your plan is to consider the following slide. Whenever you're progressing, you want to consider your volume, your intensity, and your frequency, and you never want to change all 3 at once. Likely you only want to change one component at a time. The running physio suggests that if you run a total of 0 to 10 kilometers in a week, that you can progress up to 30% the next week. So for example, if you're running 10 kilometers on week 1, you can progress up to 13 kilometers on week 2. The following week, you can increase your total mileage to a maximum of 20%, which would result in something like 15.6 kilometers. Again, this is a good rule of thumb, but obviously it will vary depending on the level of running and some of the other scales we just talked about. You need to do what feels most comfortable for you, but we would definitely suggest not going over these percentages. He also suggests that you rest every 3rd week. So essentially you need, let me regather that. Sorry. You need to rest every 4th week. So what you should do is every 4th week, reduce your percentage by 10 to 30%, but you can keep your pace the same. So we're looking to decrease your total mileage. The other thing is to obviously insert recovery days after really hard runs. Again, this will help give your body time to recover. We also just wanted to do a quick note on pain here. We wanted to point out that running is an inherently uncomfortable activity for a lot of people. It can cause a buildup of lactic acid in the muscles, which is a byproduct of energy expenditure. And this lactic acid kind of feels like a burning, but it should dissipate relatively quickly after an exercise. While some discomfort isn't abnormal, we would like a side stitch or some light cramping, you should not be feeling sharp pain, prolonged pain or discomfort, or chest pain during or after your run. If you are feeling any of these during your run, you might want to consider easing up and better yet going to see a healthcare professional or a doctor to make sure that everything's okay. So with all these running tips in mind, you did it, you completed a run. Now what? Always suggested to do a cool down of about 3 to 5 minutes. So this can consist of brisk walking and then progress to gentle walking and then rest. It's important for a number of reasons. For one, it allows us to get continued blood flow to working muscles, which helps in the removal of waste products from the muscle like lactic acid we were talking about and carbon dioxide. Secondly, it allows for muscles to gradually return to resting length, which reduces their tension, encourages relaxation, and helps protect you from injury. So again, the takeaway from this slide is please do not sit onto a bench and recover after a hard run, or even worse, go onto your couch. You should keep moving for about 3 to 5 minutes after your run, even if it's just light activity. This is usually where we also encounter the age-old question to stretch or not to stretch. This question comes up often, and the number one reason we hear is that stretching will improve our flexibility. While this is true, runners do not actually require the same amount of flexibility as, for example, dancers or martial artists. We need only about 10 to 15 degrees of hip extension to run. So one study published actually suggested that runners who had less flexibility performed better than those who had more. Other studies have been done with similar results, showing no decrease or change in the amount of injuries between runners who stretch versus those who do not. That being said, you do need a certain amount of flexibility for your everyday life, whether it be playing with your kids, working in the yard, for your job, or playing sports. So stretching post-run is an opportune time to improve flexibility because the tissues will be more susceptible to the change in length and the relaxation effects we get from stretching. If you'd like to perform stretches after a run, we would just suggest that you respect your pain, and I'll explain in the next slide. The second benefit that we often hear from stretching is that it decreases muscle soreness. Keep in mind here that slight muscle soreness is normal after many types of exercises. Again, we have a buildup of that good old lactic acid, which can cause slight discomfort, as well as small micro tears in the muscle tissue. It's actually the repair of these micro tears that make us stronger and allow us to progress. So aggressive stretching can obviously increase the tears and can result in more pain and possibly a muscle strain. Several studies show that adequate recovery is more efficient in decreasing soreness than a stretching program. So if you're someone who does get very sore after exercise, adding a quick cool down and a proper recovery routine might actually be more beneficial for you. Some of you may also be familiar with foam rolling and use it often to help improve your mobility, increase blood flow to your muscle, decrease scar tissue, and improve parasympathetic nervous system response, which is essentially your ability to rest and for the muscles to relax. Unlike stretching, foam rolling releases the fascia around the muscles, and its effects resemble more something like a deep tissue massage. While it may feel good to do this, there's actually not enough studies out there to conclusively say if it significantly increases a person's performance or decreases their chance of injury. So we would just advise that you avoid joints and keep it relatively pain-free, although many of you that have done this know that it is not the most comfortable thing in the world. So we know this is a lot of information. There are a lot of ways to stretch. There are a lot of ways to foam roll. So we just wanted to highlight some of the main muscles that we use when we're running so that you can address them if you decide to put together a post-run routine. These muscles include the quads, which is the front of the thigh, the glutes, which is your butt, your hip flexors, which is the front of your hip, hamstrings and adductors, which are the back and the insides of your thigh, and then your calves, which is self-explanatory. So there are a lot of ways to do this, like we mentioned. We're not going to go into the nitty-gritty, but just know that this guy will always be around to give you a high five for a job well done. So that's it for the main points. We wanted to summarize. We know we gave you guys a lot of information. So a few of the takeaway points is that overall, running has a number of physical and psychological benefits. Keep in mind your general health and your physical capabilities. If you're someone that is not used to exercising or not used to certain distances, it's always better to start lighter. And also go see a doctor or a healthcare professional if you'd like to be sure that it's safe for you. Try different shoes on and wear what is most comfortable for you. There is no right or wrong shoe. And stay hydrated throughout the day. Before exercise, an activation or a warm-up routine is always suggested. We presented you a few options, but if you have your own that you like to use, by all means, try it out. And plan your routes. Plan it in your day, plan your runs properly. During exercise, understand that progression is key and that it will take some time to get there, but you will get there. Understand also that discomfort is okay, but pain or prolonged discomfort is not. And it's obviously really important to track your progress for a number of reasons. After exercise, try to implement a cool down. So walk for 3 to 5 minutes after your run. You can perform stretching or foam rolling as tolerated, and you should really put a large emphasis on recovery. So that being said, I'm going to pass the baton on to Leanne, who's going to go through some of the questions that you guys had.
Hi, I hope you guys enjoyed our presentation. The first question, well, I think Belge can answer that one. Can you translate 4-foot striker in French?
Yep, sure. I think it was demonstrated in the PowerPoint, but 4-foot strike en français serait une attaque avec la plante du pied, donc ou le devant du pied. Mais je pense que le terme approprié serait la plante du pied.
The next one is, does it take more energy to make smaller steps than fewer short ones?
C'est difficile à. I'm sorry. It's difficult to have a true answer on this, because if you take smaller steps, we feel like we're moving more. But the fact that we don't have that deceleration phase every step that we're making and then trying to propel ourselves back forward, studies are tending to show that the best economic way to run is actually to have a higher cadence. So we're more optimal, so we're using a bit less energy if we're using a higher cadence, because we're not creating all these deceleration and re-acceleration every time we step.
You mentioned that running had an effect on sleep. The study was in adolescents. Is it the same in other age groups? What were the exact changes in sleep? Did it help to fall asleep, maintain sleep, improve sleep quality, or increase the amount of sleep? I'll be honest with you, it was a very broad study. We will be providing all the resources at the end. I don't believe it went into details about other age groups. It was really a study that was isolated in adolescents, but we will for sure provide, if anybody would be more interested in seeing the links and the resources that we used for the presentation. I don't know if Vicky or Serge would like to add anything in regards to that. Nope. Okay.
At the end, and so we can go through the list and see if there's anything to add on that for sure.
Yeah, so someone also asked in something similar, is it possible to get the links? Absolutely, it's at the end of the PowerPoint presentation, so we will provide that for anyone interested afterwards. What is the ideal cadence? How to improve it?
Well, the goal that seems to be there the most is at around 180 steps per minute. Most studies will, or most people will say that higher than 170 is ideal. But in the same time, there's some, I think the Courir Mieux is looking at different elite runners, and it's not necessarily true that all elite runners run at 180 steps per minute. So some are more at 160. But again, 160 is still pretty high cadence, but usually most studies show that 170 and higher is usually more optimal as a cadence.
Someone asked, which type of foot striking is good for beginners?
Well, this is a good question, because most people we tend to go more into a heel strike, but there's actually studies that show that if we're trying to get people to run with a 4-foot strike, the ones that were able to modify or to be able to keep that 4-foot strike were beginners, because they didn't have the old style of running. So they were actually learning to run and getting that running pattern to a 4-foot strike. So I guess knowing that it will reduce some of the ground reaction forces if we strike with the 4-foot, and we have a larger cadence when we run, it'd be ideal to trying to run more of a mid or 4-foot and less of a heel strike.
Someone else asked, do you need to be able to do all the strength exercises that you showed before running? Would running itself make you stronger?
Yep. So running will inherently make you stronger. This is an example of something that we would give to, for example, an athlete if they were suffering an injury and we weren't sure if they were ready to go back to running. These are some of the basic tests that we would do. You are not required to do them. And just like I mentioned a number of times during the presentation, your inability to do them doesn't mean that you shouldn't be running or doing physical activity. It might mean that you can use these tests to then strengthen. You can use those same tests and do them over a repetitive time to be able to strengthen and improve your running. That being said, you can also just start at a lower pace and maybe try a lighter volume and then progress from there as you feel better.
Another question was, do you have the contact information of the Runners Club? Thank you. So yes, I'm sure we can provide that at the end, no problem.
Well, the issue is you can look into your local area to see where some of the running clubs are, because obviously we could give you some, but that would be more for where we are. So, you know, there's the running room is a really great one that a lot of people use. I'm sure Selge, you have a few others. I can't think of any off the top of my head, but
yeah, I think the running room is really the one that we see most, and it's pretty much partout au Québec. So.
What are the consequences of running at too high BPM following the formula 220 minus the H?
Yeah, so that formula is a very global formula. There's a lot more specific ones that you can get online. But obviously, if we run at a heart rate that's way too high for what our max should be, you put a lot of strain on your heart. And so you don't want to do that for obvious reasons. You know, if you have a heart defect or high blood pressure, that could cause a lot of other complications, whether it's dizziness, high blood pressure, that's chronic. Obviously, we don't want a heart attack either. So there's a lot of obviously consequences from heart strain, and so you want to try to keep it within those ranges. Of course, if you were an elite athlete, some people do push it beyond that, but for beginners, we do suggest that you stay on the lower spectrum of things until you know that the exercise is well tolerated.
What kind of precautions that someone with flat feet should take into account when running? Are corrective shoes the answer?
This is again, a good question, a tough question that depending on the expert will give you different answers. I think it's always good. I think that exercises and running and trying to let your foot do the job and having a better musculature in your foot and the rest of your chain can improve and can make you stronger and less injury prone. But in the same time, in some cases, a corrective shoe or orthotics can be indicated. Some people have been shown to have knee pain, and they tried lots of stuff, and once they corrected the arch, then a lot of the knee pain went away. So I guess it's a person-to-person thing, and we need to try some stuff. With some clients that I have, sometimes they do have the correction or the orthotics, but when we are in the gym, we try to work out without them. So we try to work barefoot and trying to increase the strength of the foot, and then we work from there. But yeah, there's probably lots of different answers on this question.
Yeah, there's a lot. And I think what's more important is also your ability to adapt. So some people have a really high arch, but it's very rigid and they can't move their foot. And our foot was really designed to absorb a lot of those forces. And really, you know, the ground reaction force travels from there up. So if you're able to absorb and it's mobile, a lot of times there's no issues really with it. You're functional. It works for you.
Absolutely.
The next question is, do you have any recommendations for post-run supplement recovery?
Well, on the supplement itself, not really. I think there's lots of I think the best people would be a nutritionist to answer this question. But usually I think we can find almost everywhere that once we finish a run, we'll need to refuel with some carbohydrates, with some proteins. We need some fat also. Our body will need that. And depending again on the intensity of the workout is going to be different. So I can't give you a specific answer. You should take this amount or this type of protein when you're done. But our body does need to refuel both water and food once we're done a workout.
Thank you, guys. Sorry to interrupt. I see we do have still quite a few more questions. I just wanted to let everyone know we are coming to the end of our talk. It is 11 o'clock right now. Maybe we could take just one more question, and then if we haven't gotten to your question, we'll try our best to answer some of them offline by posting them on our website, but you can also send us an email at any time.
I'll ask one of the questions related to injuries, since we are athletic therapists. If someone is experiencing hip and ankle pain with heel strike running, would you recommend them to change to forefoot striking?
I think that's a tough thing to answer. It would probably be best that you see an athletic therapist or a physio to get assessed to understand why you're getting that pain. It could be from a heel strike, and obviously, as we know, by forefoot striking, we decrease our ground reaction forces, and if that's all it is, then great. But if you do have any underlying issues, it won't necessarily correct the problem either.
Yeah. And well, if we're taking one of the big running experts in Quebec is the La Clinique du Coureur, and they would probably answer yes to that question, and I'm not against that either. It's just that, like Vicky said, we need to see what is the reason why you're getting these pain, and then if we're going to go to a change, it needs to be done progressively. Because if we're just going right away to a forefoot strike or to a minimal shoe, then we can create other types of injuries. So we really need to go progressively, and maybe we do like a part of your run that way and the rest of your run the way it used to be done, or maybe like change shoes or have your route done that it's done in half, and you can stop back at the house and change shoes and then go back for another part of your run. But it's really, it's a tough to answer specifically for everyone. It's necessary. It's definitely something that can be looked at, but it needs to be done progressively.
Great. Well, thank you very much. That seems the time we have right now for all the questions. So thank you very much to all three of you for the wonderful talk. And to everyone else, this talk is being recorded and will be posted on our website if you want to go back to review some of the information. All right. Have a great day, everyone. Stay safe.